The information contained in this podcast is intended for educational purposes only and is not intended for diagnosis or treatment. The views expressed do not represent those of our institutions or the APA. Enjoy. Hello, welcome to the American Journal of Psychiatry Residence Journal podcast. I'm Barrington Hwang, one of the media editors. We've got Dr. Raza Sagarwala, one of the co-residents here at Vanderbilt.
Hi, everyone. And
one of our medical students, Evan Watkins.
Hello.
Again, this is for education, and neither Dr. Sagarwala, our student Dr. Watkins, Dr. Jeckell, or I have any financial interest to disclose. Dr. Jeckell is currently an assistant professor of psychiatry and behavioral sciences here at Vanderbilt University Medical Center. He is originally from Toronto, but grew up in Florida, attending medical school in Tampa at USF. Then he did his training at Jackson Memorial Hospital and University of Miami, then finished up with child and adolescent psychiatry training here at Vanderbilt. His specific areas of interest include sports psychiatry, concussions, human performance, anxiety disorders, and depressive disorders. Outside of work, he enjoys cooking, playing guitar, spending time with family, and activities of ice hockey and Brazilian Jiu-Jitsu, as well as others.
Thanks for sharing that with us, Barrington. I don't think we can encapsulate the impact Dr. Jeckell has had on all of his patients. I've really enjoyed this last month on child psychiatry so much that I'm actually considering going into it. I haven't really seen how interest in sports could be integrated into psychiatry. It's pretty awesome to see, being someone who's super into all sorts of sports.
We'd also like to welcome our guest, Dr. Aaron Jeckell. Tell me a little bit more about when you got interested in sports psychiatry.
Came up to Nashville for fellowship at Vanderbilt. And that was where some of the sports psychiatry interests really took off. I'd always been interested in sports and how athletes experience mental illness and the different aspects of mental health in that population. Here I got connected with a group that does a lot of really fascinating work in sport-related concussion, and then ended up just going down this rabbit hole of what a fascinating injury, how much we do and how much we really don't know about it, and realized that the sport concussion piece is this injury that's predominantly managed by orthopedic surgeons, sports medicine teams, neurology. And you look at the symptomatology that someone experiences after a sport concussion, and it's like impaired sleep, cognitive deficits, mood symptoms, irritability. You look at this litany of symptoms that are all neuropsychiatric in nature. We have expertise in this. I know how to treat all of those things. So started to realize that really psychiatrists should have a seat at the sport concussion table, and started working with these people and was really enthused by how valued my input was into it. They kept coming to me for questions about management and that kind of thing. And that really took off into the work that I have been doing here.
If anybody out there is kind of wondering how they would get into sports psychiatry, well, of course, you're in medical school, then the adult psychiatry residency, plus or minus the child psych fellowship. And then is it just a matter of getting a mentor in the field?
A good way to do that, there's the ISSP, is the International Society for Sports Psychiatrists. And that is a group that I believe you can join it as a medical student, certainly as a resident. And then there's individuals practicing in that group all around the country. It actually has a curriculum that you can follow. So a lot of people can do it as like a fourth-year elective, where every week you read a different chapter or do a different segment of the curriculum, answer questions, submit it at the end, do a capstone project, and you get additional certification as a sports psychiatrist. So I think the thing to realize is that it's such a diverse field. Athletes themselves as a demographic are really diverse. And then there's like eating disorders in athletes, mood disorders in athletes, substance use disorders in athletes, performance optimization kinds of things in athletes. It really runs the gamut. So a lot of ways to get involved.
Curious to hear how your training in child psychiatry kind of helped your subspecialty interest in sports psychiatry. Was there other advantages?
I think there are, because when you talk about athletes, they're predominantly either youth or young adult individuals. I do some work with professional athletes and collegiate athletes, and they're young adults for the most part, but it lends itself really well. I also think that being engaged in sports as a youth or as a child and adolescent is really, really good for you. You learn so much from participating in sports as a young person. Teamwork, communication, responding to adversity, all of those kinds of things. So in collaboration with different like pediatricians, as a child psychiatrist, you can really push engagement in sports and those kinds of things.
Are there any other considerations that you have to take into account, I guess, like depending on the sport, or is it a specific demographic within, I guess, sports that we have to keep in mind?
I think just taking into context different factors of the athlete is important. So like working with a professional athlete, for instance, their athletic performance is their life. It's their job, it's their career, and they're so dialed in mentally. They wouldn't have gotten to that point if they were already dialed in mentally. But then there's the pressures of responding to injury. They could get traded any day. There's transitions, retirement, those kinds of things. When you work with collegiate athletes, they're working, if you consider the amount of time they're putting in the classroom, and then on the field, like 70, 80, 90 hours a week. It's unreal. Waking up every morning at 5 o'clock, hitting the gym for an hour and a half, going to class, going back to practice. The pressure there is unreal. And then, working down with younger athletes, 99.9% of youth athletes are not going to be putting bread on their table by playing sports, but they can be benefiting from all of those things that I mentioned about from their participation in sports. An interesting thing that I see a lot in like the NCAA athletes that I work with is you get kids from all over the country who were the best athlete in their high school, the best football player, tennis player, whatever. So they experience that level of eliteness, and then boom, you get to Vanderbilt, you're in the SEC, one of the toughest conferences, and boom, you're no longer the best, and you start to question your abilities and your decisions, and anxiety, mood symptoms can really creep in at that point. Transitions can be tough for athletes, so that's, I guess, one thing to keep in mind, especially at those more elite levels.
If someone was interested in getting into more sports psychiatry, how would you recommend someone sort of starting that interest and getting into that?
Well, there's joining that group would be a start. There's a lot of good books out there on sports psychiatry. If you were somebody at a residency program that didn't have much of a connection to that, the way I'd probably start is by talking to some of the athletic trainers or coaching staff or sports medicine people in the community or wherever you're at, and I can almost guarantee you they would be really eager to have the insights of someone with expertise in mental health either come and talk to them, give a lecture. I've done that before where I've given a talk to physical therapists or athletic trainers, and they've got so many questions about mental health, like, oh my gosh, my adolescent athlete, I think they might be depressed. What do I do? So they're really hungry for our expertise out in the world. So I guess, the way to get into it is to make it known that that you're available, that you want to get into it.
I'm curious to hear what are the most common diagnoses you see specifically within sports psychiatry, like concussions, or is it more like the mood disorders?
For me, it's concussion because I have particular interest and expertise in that. So here at Vanderbilt, we have a concussion clinic, and I take a lot of referrals from that group for individuals, particularly people who are experiencing post-concussion syndrome. I'd say after that, and this is not representative of what athletes experience, but what I get referrals for, I'd say first is concussion, then it's probably mood symptoms, anxiety, depression, and then probably after that, maybe ADHD. Those would be the most common things that I see.
And then with the increased focus on concussions and the sequelae from concussions, how do you see sports changing over the next decade or two?
That's such a good question. And it's tough because youth sports has experienced kind of like a 1-2 punch at the moment. Before COVID hit was the few years, like 18, 19, 2020, youth football and youth basketball, we're seeing a decline in participation for the first time in decades. And a big part of that is fear over concussion. Had COVID not happened, I think I would have expected that trend to continue. I think that's tragic because you can still play those sports in a safe way. I think that what I would have hoped would have happened is that different changes to sports would take place, improvements in equipment, better rules, better recognition of concussion, that maybe that trend would eventually reverse and participation rates would continue to climb. But then with COVID hitting, there's a scary estimate that 50% of different youth sport leagues will fold because of this and may not be able to regroup because they're going to lose funding, they're going to lose access to different fields, arenas, stadiums, those kinds of things. So it's a scary time because I don't know what the next 10 years are going to bring for participation in youth sports. And like I said, I think that, having young kids involved in that kind of stuff is really instrumental to the development of like good citizens, good people. It's a cornerstone of youth development. So I just hope we recover from all this. I'm optimistic, but we need people who are really pushing for that.
I think in the article that you sent us, the general public sentiment right now, without going into too much of the details, is minor head injuries at different times. And there's a lot of steps, but I think the public is thinking that automatically means CTE or chronic traumatic encephalopathy. I guess, could you comment on that? And, it seems a lot more complicated than just that.
Yeah, it's incredibly complicated. And I don't think that there's any way I could do that conversation justice in the short amount of time that we've got, other than to say data and the research on CTE, it's really in its very beginnings these days. We have so many more questions than we have answers about that. What you see a lot in the media is there was a big paper that came out, it must have been about 2 years ago, done by Mez, that found that 110 out of 111 former NFL players had CTE. And you saw these hot headlines, blasted on ESPN and the New York Times and all that, saying like 99% of former NFL players have CTE. Your lay person in the community sees that and they're like, my God, no way I'm going to let my kid play football. The reality is that there was a lot more to that study and that headline than meets the eye. It was a convenient sample of individuals who were selected specifically because they had neuropsychiatric issues. And then on pathology, which is the only way to diagnose CTE, on pathology, they did find CTE of varying degrees. We as psychiatrists know that any kind of mental illness is due to a combination of biological, psychological, and social factors. So, all that to say is that the CTE question is super complicated. We don't have the answers just yet. And I think that rushing to pull your kids from sports because of that is preemptive. I think that there are ways to make sports safer, and we need to do that. Ultimately, the goal should be to make sports as inclusive and safe as possible so that as many people can engage in a way that's safe and responsible as possible.
What local organizations are you involved with? And could you tell us a little bit of what a routine work with them would look like?
A couple of different groups I'm involved with. Youth sport groups, we do some advocacy work with them, talking about sports safety, increasing access to different youths. I'm a member of the Sport Concussion Research Group here at Vanderbilt. We do a lot of different work, from writing book chapters to pure research, data crunching kind of stuff. I do a lot of work with some of the local colleges. I do some work with some of the local professional teams. The work with the different colleges is fun. I've got good relationships with some of the athletic trainers, and they'll, if they've got an athlete that they're worried about, they'll give me a call or get in touch with me and say, hey, so-and-so has got something going on. Can they come in and see you? And I set it up. Managing privacy is really, really very, very important. So making sure that athletes know that I don't work for a team, I don't work for a trainer, I work for them is really important. Fostering that trust is crucial.
Is there a big challenge kind of with athletes kind of to address the stigma of mental health? I think of high achieving athletes as very macho and I'm going to do this myself. I don't need help. I've always been able to do this. How do you tackle that stigma around mental health?
Such a good question. There's definitely a stigma against mental health in the world of sports. It's worse in some areas. You talk about, the macho stigma. There's, in hypermasculine sports, stereotypically hypermasculine sports, historically there's been this idea that you don't talk about pain. You play through the pain. Pain is weakness. And that's not a healthy way to go about life in general. You tell an athlete that, if your shoulder is hurting you, you got to respect it, because if the injury gets worse, then you're going to be of no use to the team. And truly the same is the case for mental health. You're seeing a lot of athletes who are either firmly established or towards the end of their career these days coming out about their mental health struggles as an athlete. And they're getting, rightfully so, they're getting applauded for doing so and working on breaking down the barrier. It's less common to see athletes in the very beginning of their career open up about these kinds of things because they're afraid it's going to affect their their chances to play. So I think to break down that barrier, you have to create the message that athletes get depressed, athletes experience anxiety, mental health affects everyone, that mental health can affect athletes differently, and that if you want to perform at your best, you need to take your mental health as seriously as any part of your physical health. So if you want to get to that next level of play, you need to take real good care of your mental wellness. And if there's an issue there, that you address it. But that also goes back to the privacy thing. As a clinician, and you have an athlete open up to you about their struggles, they need to know that those conversations are safe, and they're not going to get back to their trainers or management or whatever the case is.
Do you have any ideas on how to make sports safer, especially something like football where it's so physical, while still maintaining the excitement of the sport? Because like the NFL, right? I mean, they've over the last 5 years, they've made changes to like the kickoffs, but now like barely anybody's returning the kickoffs. The onside kicks are difficult to return, but it takes away some of the excitement. And I'm sure players themselves enjoy the kickoff, the fans enjoy it, but it's also one of the most dangerous aspects of the sport.
Yeah, it's really dangerous. The leaps and bounds that they've made in athletic equipment has been really interesting, but it's a double-edged sword. You get kids in these helmets that are branded as concussion-proof or make them think that they're Iron Man. In some cases, may put them in situations where they're more likely to be injured because they're going to engage in more reckless plays. There have been efforts to ban tackling in football under a certain age, and certainly that makes football safer under that age, but then you got a whole bunch of heavier, stronger, bigger adolescents all of a sudden can tackle and haven't maybe necessarily learned how to tackle appropriately at that younger age where they were less likely to hurt each other, and then you get like a spike in injuries later on. Hockey, for instance, players have to have a stop sign on the back of their jersey so that they don't get checked behind. If you can see the stop sign, you can't hit them. I think one thing that we're getting better at, and I think maybe like the holy grail of concussion detection, for instance, is like the sideline test that can confirm whether or not you've experienced a concussion. We're getting better at detecting them and picking them up. But if you can do a saliva or a finger prick test that says, yes, you've experienced a concussion and we need to get you off the field now. Because that's one of the big dangers of concussion is experiencing a second head injury shortly after experiencing the first one. So if we're better able to detect concussions, get them out of play, that would be a huge step forward in making sports safer.
Gotcha. And while we're speaking about concussions, exactly, I guess even know what timeline we're working with regards to like what's a normal recovery time. I guess maybe a month or so, but I mean, that seems like neurology can help with that, family medicine can help with that. There are a lot of different specialties. And where does your specific expertise with psychiatry come into play? Because I know that with some of the articles we had talked about, some medications that can increase dopamine have been shown to be helpful, so like amantadine stimulants. Yeah. At what point would we consider that? And what else are you able to add to the team that's specific to psychiatry?
Really good question. You should read some of the articles. I'll send you some more articles that I've written specifically about that. So a typical recovery depends on a number of different factors, and there's a lot of factors that can predict a prolonged recovery. 80-ish%, depending on the study, 80% of people will have recovered within 30 days. Older athletes, more elite athletes tend to recover quicker. Younger athletes tend to take a little bit longer. The truth is that there is no FDA-approved medication for the treatment of concussion that I'm looking at. There are off-label uses of medication that can kind of speed recovery. So where I come in, for instance, is an athlete, maybe I'll give you an example, a high school football player experiences a concussion, has a classic kind of response of like dizziness, lightheadedness, phonophobia, can't sleep, concentration is impaired, and their mood drops. And then, what we would expect is they experience some of those symptoms for a couple of days, and then gradually they start getting better, one by one, until they're able to get back to school, and then maybe 2 or 3 weeks later they're able to pick up a light jog, and then a couple of weeks after that they're back on the field and fully recovered. Where I come in is if that doesn't happen. So if somebody's experiencing prolonged symptoms beyond what we would expect to be a normal recovery, most people would say that's about 30 days. Then it would be appropriate to think about, all right, can medicine be helpful here? Again, no FDA-approved medications, but we can use medicines in an off-label way to target specific symptoms that people are experiencing after a concussion to help speed that recovery. The thing that I always look out for is distinguishing between a pre-existing and a persistent symptom. So, I'll get an athlete in who had a concussion and then they're really struggling with mood symptoms. And I do a really close and careful interview and conversation with them and their family and find out that actually before the concussion, their mood wasn't so hot either. And it's way worse after the concussion, but there was probably enough to meet criteria for maybe like a mild major depressive disorder or anxiety disorder beforehand. If you have any kind of mental health issue prior to a concussion, you're more likely to experience a prolonged recovery and you're more likely to have those symptoms kind of flare up afterwards. So that's kind of what I'm on the lookout for when I work with people for experiencing, worsened mental health issues after a concussion.
So I've got a question about alternatives to football. Like I've seen like the padless football and rugby with the idea of like if people aren't wearing pads or helmets, they may be less aggressive or like tackle with better form. Is there any data to back that up?
There definitely is. There's a lot of studies, especially in football, looking at when and where different injuries happen. I don't have the exact results at my fingertips, but there's certainly information out there to suggest that more padding makes athletes more likely to engage in reckless plays. Rugby is definitely not without its fair share of injuries and concussions. But yeah, there's definitely a lot of interesting information there suggesting that overprotective equipment can lead to more injuries in some cases.
Interesting.
Yeah, it is. It's, you try to do something helpful and it kind of backfires on you.
Do you ever work with any middle-aged to older populations?
Yeah, I do. And I think I like doing that because it's it's nice to see people staying active throughout their life cycle. So I've worked with older individuals who are either professional athletes in sports where your lifespan is a little bit longer, professional golf, equestrian, cycling, those kinds of sports. And you kind of just see the benefits of participation in sport persist. They're more engaged interpersonally and they've got a stronger sense of self very often. And so yeah, definitely across the different age ranges.
Yeah. And the other article you sent, and it was about hazing. Could you, I guess, just touch on that subject? I know that's not just in sports, but we also think about college organizations, small groups in primary, secondary school as well.
Medical school.
Yeah, I guess could you touch on hazing in sports and
Sure.
what that looks like and what we can do?
Yeah, it's such an interesting thing. So there was one of the papers I had recently written with two sports medicine individuals, Alex Diamond and Liz Copenhaver. It was a fun paper to write because it kind of took me down this almost anthropological wormhole where you're looking at like, all right, what is hazing? Why do we haze people? What are these initiation rites that we do? And like every culture since the dawn of time has done some kind of an initiation rite. Tribes will send young kids out to kill a lion or something like that. So like, your bar mitzvah, you're 13 and now I'm a man and can join the adult community. Like, why do we do that? There's a lot of different reasons to do that, and those kind of persist, and you can see them representative in sports. An initiation rite is you're kind of broken down and rebuilt and reborn in a new image more cohesive with the group. You've gone from a non-member to a member, and in doing so, you become someone that you can trust. And in sports, that's important. If you're a quarterback, you need to know that the linemen are people that you can trust, because if you can't, maybe then, you're going to get blitzed and seriously injured. So it's really important. And there are healthy and appropriate ways of doing team building exercises that fulfills that need. But bullying and hazing in sports is when it gets really ugly and when it gets out of control and people are really broken down in potentially disastrous ways. There's cases of kids dying from hazing events. So it's an important thing to be mindful of. And there's a lot of things that as coaches, parents, you can be mindful of in order to prevent that kind of thing from happening. So for instance, promoting healthy team building. All right, guys, we're gonna all wake up at 5 o'clock in the morning and we're going to run up this hill. And we get it to the top of the hill. We're going to do something emblematic of this thing that we've accomplished. It's going to be brutal and exhausting, and we're all going to do it together. Boom, you've accomplished exactly what hazing would try to accomplish. But the data about people who've experienced hazing, which is pretty dramatic, something around 80% of NCAA athletes have experienced something that would qualify as hazing, but only like 10 or 12% of them would actually fess up to it. There's this code of silence around hazing. It causes long-lasting damage. People will think that hazing is actually a good thing, like it's important, we've built team unity and all that, but the data actually says, no, you've created a lot of like micro divisions amongst the team. It hurts team cohesion and unity. And in addition, it's just dangerous.
What's the best way to get that message to coaches and captains on teams?
It depends on the level of play. Like obviously a zero tolerance approach to it at any level is important. Hazing is less likely to take place if there's a more assertive coaching presence. So, making sure that there's an adult in the room at all times at lower levels of play. But then as you get to more elite levels of play, I think it's really pushing that message that you are less likely to be successful as an individual or a team if you engage in hazing. Hazing hurts teams. You can build team unity in a healthy way and team cohesion in a way that will help you as an individual and a team be successful. And if at the end of the day, winning is everything to you, you're not going to haze. You're not going to engage in that. So giving them resources to do what they're trying to accomplish in a positive way and reinforcing the negative consequences of hazing and bullying on performance and success.
To wrap up, for any medical students, other trainees, other people out there, do you have any tips or advice?
And golden pearls of wisdom?
Golden pearls of wisdom, and any other thoughts for just general advice?
I think just for everyone, it's find something in what you do that's special and really excites you. For me, finding that I had an interest in this sports psychiatry and concussion world opened up so many cool opportunities and relationships with really interesting people and different things that really like add spice and excitement and adventure to being a psychiatrist. So, whatever you get into, find that like special little angle and approach to whatever it is that you do that kind of sets you apart. Go at it full force. Which is kind of like good advice for an athlete,
Yeah.
Find that skill that you've got that sets you apart and go at it full force.
Yeah. I was going to say run with it.
Run with it, skate with it, throw with whatever it is.
Yeah.
And stay active.
Stay active.
Take care of this biological machine that we live in. Feed it good fuel.
Again, we appreciate your time with us, Dr. Jeckell. We think your impact is invaluable. We appreciate you listeners as well for listening to the American Journal of Psychiatry Resident Journal podcast.
If you have any suggestions or topics you'd like to see, feel free to come interact with us on social media. We've got Facebook, Instagram, YouTube, Twitter, and feel free to subscribe as well. We look forward to tuning in next time.
Bye.
Bye.